Thank you very much, Dr. Okonji, for agreeing to be on our YouTube channel as we celebrate the 10th anniversary of the retreat. And as one of our partners, we just thought that we would want to just have a feel of your thoughts concerning mental health in the workplace, especially because we've been one of those doctors who have referred to us people from the workplace. So thank you, Karibu.
Yeah, thank you very much, and I think it was a good idea to discuss this very important topic of mental health in the workplace. We find two types of workplaces. One type is a workplace where there is what I call there is a human face in the workplace. If you find such a workplace, then that workplace will be very accommodating to the people who fall ill in that particular organization. And even more so if they are mentally ill, because they will understand that this person who has fallen ill has been very productive to the company. And so they will be wondering why now? Why is this person falling ill now? So that will be one scenario of the workplace, a very understanding workplace.
What you call the human face?
A workplace with a human face. Then we have another type of workplace, and that is workplace that I normally call workplace without a human face. And this will be very hostile to anybody who is ill, and in particular, anybody who is mentally ill. They will not take into consideration at all whatever they have done to that organization. In fact, these are the people who are who are sympathetic with a human face. They will, in majority of cases, try to look for help for the person who is mentally ill.
But Dr. Even as we talk about these organizations with a human face, what is the financial implications to these particular organizations when they undertake probably to either treat their members or just by the members being sick? What is the financial implication to the organization?
I think we must accept that in any workplace there will be people will fall ill, and the workplaces must plan for people falling ill while they work for them, because it is a natural process. And you will find that a number of organizations who particularly who are have a human face, they will have made some provisions for the treatment of the people who fall ill, and particularly the people who become mentally ill. They will have, for example, insurances, and in which case then it will not be a big problem to the organization. We, of course, must also accept that sometimes the treatment of mental disorders take a long time. But let me reassure you that with good care and with good follow-up, we know people who are mentally ill who have been so productive. The problem is that no provisions are made for them, and so they become less productive. And of course, that has some financial implications to the organization.
Probably, Dr. The biggest concern would be, and I agree with you, that organizations should take care of their employees. But what are the signs? You see, these are the illnesses. When you're feeling you have a headache, you know you have a headache. But when it comes to mental health, will the employer realize that
my staff is having a mental health complication, will the person themselves, or are there symptoms that we can look out for?
There are, and I think that's a very important question, in the sense that the employer will have known the employee. They will have known the strengths of the employee. They will have probably have spent a lot of money in training that employee. And in the majority of cases, it will be an employee who was a model employee. Probably, you know, some of this, when you evaluate people at the end of the year, there are probably people who have been evaluated very highly. And then, all of a sudden, this person who was evaluated very highly start to have a problem. And some of the initial problems are, for example, people coming to work late, or people getting absent from work, or they exhibit some signs which are not really them. There were people who are very cooperative with the other employees. You may find they become very irritable. Some of them may even become very confrontational. And this is in a person who in the past, these things were not there. So I think it is important for any organization that if an employee exhibits some changes in behavior which is not like them, then those are some of the early symptoms or the early signs that should indicate to that employer that this particular employee needs help.
And as we probably wind up, Dr. Ari, again, tapping into your experience over the years, would you say that we are seeing an increase in mental health illnesses at the workplace?
Yes. I think we must accept that the workplaces are progressively becoming very stressful to employees. The workplaces are not very sensitive to employees. They are more interested in what they get from the employees. And so that we are finding that there will be a number of problems, psychiatric or mental health problems, which will increase, in particular, anxiety states, depression, and alcoholism. We sometimes have found out that people who were never dependent on any substances like alcohol, they suddenly start to become dependent on them. And when we evaluate them, we find that it is the dynamics of the organization. It is what I call the organizational dynamics, which are negative. So, in a nutshell, I think the more acceptable, the more understanding the organization, the less the psychological problems. The less understanding the organization, the more the psychological or psychiatric problems in that organization.
I think you've answered my last question, which was the role of substance use, especially the sudden rise in substance use in a worker who was previously productive. When you talk about them trying to use substances as probably a escape mechanism. And also to try and self-medicate. So an employer who sees suddenly this worker who was a productive worker but is no longer coming to work or coming to work drunk, probably they need to check their
person in book an appointment with a psychiatrist?
I think if the organization is sensitive to the employees, that particular employee needs to have an urgent evaluation. And in most cases, we are able to nip the problem in the bud. The earlier you get them, the better. Unfortunately, sometimes people don't get them early, and then we end up with a situation where the condition now is much more severe. And the severer the condition, it therefore means that that person will have to, the treatment process will take longer. And when the treatment takes longer, of course, then the productivity of that employee and of course goes down. So I think it is important for the employers to be sensitive to some of these things so that there is early intervention. And even more important, there must be certain things that can be used to prevent these particular problems, particularly of addiction, from catching up with the other employees. Yeah.
Thank you very much, Dr.
Thank you.
We appreciate your time and your continued support.
Thank you.
And all the best.
Thank you.
Asante.
Thanks for coming.
Okay.